And let's start with the Pledge of Allegiance, please. This is a little tricky with Zoom, so everybody has to put on their own. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. May I have a motion to approve the minutes of the, have people had a chance to see the minutes and review them? And may I have a motion to either approve or are there comments on the minutes requiring amendments to the minutes? And once again, thank you, Kathy. I thought that these were excellent minutes, and it is yeoman's work. It is a job I don't know how to do myself, so I'm ever grateful that you take it on. So, any comments on the minutes? Then may I have a motion to approve?
Motion to approve the minutes.
Second, please. A second, please. Somebody want to second the motion? Okay, thank you. And if there are no nays, let it be posted that the minutes were reviewed and approved. Now, I've kind of blasted through the beginning here to get to the meat of the meeting. This has been a crazy day. When the day started, I assumed that we would have a nearly full complement of folks and a very crowded agenda. Alex has been doubled up at work because of staff shortages, and he may or may not make the meeting, but he will not be on time. Lisa has a sick child, so Lisa will not be making the meeting. And Joan did not explain to me, and I don't think I'm sharing any confidences there. Nobody asked me to keep confidences. But Joan is unable to make the meeting, and that is a consequence of I don't know what, but she did send me notes with regard to her agenda items and how to keep those up. Furthermore,
so David, Lisa's on. Is that Lisa's? I see her name up there.
That's Lisa Curry, not Lisa Doom.
Oh, the other Lisa. Sorry, thank you.
Yes, indeed. And thank you, Lisa Curry, for being willing to take responsibility for the meeting. But that brings up, in addition, Kevin, Maura Moroney, and Maggie Myers. So, for those for whom the names are new and challenging, Maura Moroney is the new chairman of the Board of Commissioners. She was a long-standing commissioner who was the former liaison between the Board of Commissioners and the Board of Health. And Dr. Maggie Myers, who is moving into the role of being the Board of Commissioners liaison to the Board of Health. They're all at an emergent or urgent meeting of the Executive Committee of the Board of Commissioners. I'm going to guess that the downstream effects of the need for the urgent meeting is probably going to tumble to us, and we'll see how that plays out. But we have a significant chunk of our own staff and a significant chunk of the Board of Commissioners support, and Kevin all missing. Kevin did send me the health officer's report, which I did not copy. So when we come to that, I'll have to ask your forbearance and pull that up. That having been said, all of this fell out during the afternoon, and I didn't think that it was fair to the rest of you or the right thing to do for the board to cancel. So I think we should do what we can do. We should be as efficient as we can and move things that we can't take care of to our next meeting, and make plans for doing the work that we need to do in between meetings. We will have, I think, a 5-week stretch this next go, and so we're going to need to to probably do a little bit more between meetings than usual. But I thank everybody who's here for coming, and so I think we should get into it. And the first thing that I had intended to do was introduce Dr. Nuttasoren Pleapot, who is our newest member of the board, and ask her to give us an introduction to herself, and then I think we should each take a few seconds and give a thumbnail of ourselves for her. So, Nuttasoren, the floor is yours.
Hi. Thank you so much for having me. I'm originally from Thailand. I came here since 1996 for school medical training. Did my I'm a pediatric infectious disease physician, and had my residency in peds and pediatric ID in Chicago, University of Illinois in Chicago, as well as at the Northwestern University. And was very much interested in clinical research. So I had a master in clinical investigation at the time, and was able to continue that line of work doing pediatric AIDS clinical trial for some times in Thailand. They were launching an international site there. And then I moved back here. Oh, that was in Thailand. I moved back here in 2002 and was joining the School of Public Health at University of Michigan during my graduate study. I had my PhD in epidemiology and worked at the Center for Microbial Risk Assessment. And I moved again, a few moves in a few decades. Moved to Pennsylvania in 2011. I've been in Wayne since, and was doing clinical practice. And COVID pretty much just gave me an open door and give me a big nudge that I joined the Department of Health, and I'm currently working as a public health physician in the Division of Infectious Disease Epidemiology. But I should say it for the record that I'm representing myself. I'm here as a citizen. I'm not representing the state in any way. So all my decisions and my comments are of my own. So, and I'm super excited and happy to be here, and I'm so honored and looking forward to working with everybody. I'm here to listen and see what I can assist and help.
So welcome aboard. So why don't we go start with Julie, Bob, Kathy, and myself, and give a quick introduction of ourselves to Nuttasoren, Dr. Pleapot, who asked that I call her Nuttasoren, and that is a topic I'll bring up in just a moment. So Julie, the floor is yours.
Hi, Nuttasoren. I'm Julie Kohler. I'm a clinical psychologist. I just joined the board about 2 months ago, so I'm new. And I live right in Villanova, and I moved here with my family about 2 years ago. So it's nice to meet you.
Bob? You're muted, Bob.
Hi, I'm Bob DeSigiu. I'm an oral and maxillofacial surgeon. I work at Jefferson Hospital in Philadelphia. I also, besides being an oral maxillofacial surgeon, I have a PhD in population health, and I joined the board about 2 months ago, same time Julie joined, and I'm very interested in the oral health of our Radnor Township, and especially for the children. And I just put a little plug in right now that February is Children's Oral Health Month.
Thank you.
Nice.
I have to say, I listened into your recorded meeting, and thank you so much for Julie and Robert. I think you really did give me like a push that I better jump into this group here. So thank you.
Kathy.
Yes, hi, I'm Kathy Durr. I have been with the board 5-6 years now. So it's been a while. I'm currently the vice chair working with David. For whenever he's out, I will cover, but he's always around, so which is good for me. I come from the laboratory field, working in the hospitals for years and years and years. And now I went to the vendor side. I work with Siemens in their health and ears division. So I travel over the country visiting different hospitals and working with their staffs there. So I'm usually on a plane somewhere, heading somewhere. And I've been in Villanova area for the last 10, 11 years. So
Thank you, Kathy. And I've been in Villanova since 2004. I am retired from active full-time employment. Most of my employment now is consulting work. I am a diabetologist. I spent 20 years on the faculty at the University of Pennsylvania, went into industry at the turn of the millennium, spent 10 years on the drug side, about 10 years on the drug side, and about 10 years on the device side before retiring, I think it's 5 years ago, maybe 6 now. It's either 4 or 5 years that I'm on the board. If Kathy's 5 or 6, I'm 4 or 5.
yeah, you're just intermediate, thank you.
And I just started second year as chairman. And one of the things that you raised, Nota Sorn, we all have other, some of us are still working and others of us have other commitments, and we should all be transparently, when we're on the board, we're serving with our own interests and the interests of the citizens of Radnor and for the board, and we should all be as transparent as possible when conflicts of interest might arise. And I think the only difference for you in that regard is that you are a government employee for whom conflict of interest can be very, very touchy. And because the hierarchy of government is state, county, and township, and now you have one foot at either end of that hierarchy. But I think for everybody, we should be representing ourselves as citizens of Radnor Township, and when there are conflicts for our employer, make it clear that we are expressing our own opinions and what those conflicts are. And it's kind of a new topic, but I want to make sure if anybody on the board has any comments in that regard, I want to leave a minute for anybody else to jump in on that. No disagreements?
It's all good.
Okay, excellent. Now, there are a couple of other things that have been raised. Dr. Plipat and I spoke, that's one of them, on Friday. And how we name ourselves and represent ourselves and call each other is something that's a little bit catch as catch can right now. And I think for the purposes of the meeting of the board and the members of the board, it feels like everybody prefers to be called by their first name. And if you have, and I like to be called David, not Dave. And if you have a specific way that you would like to be named, I think that is perfectly appropriate. But that's not the only way we're named. And we are also named by our posting on the township website and app. And there was some, I think, confusion on your part, Nota Sorn, with regard to who was called by what. But Alex, who is not with us yet, you haven't met yet, I had pointed out that we really, and now my mind is blown with the accomplishment, education, accomplishment, employment, dedication, and brilliance of the people that are coming on the board. And Alex felt that it was important for everybody to have their degrees and their career posted as part of that, because I think that when we take action in advising, and our main role is advisory to the Board of Commissioners, that people should understand that these are individual opinions, that we're not elected officials, that we're volunteers and not employees, but that we're people that have a basis and a reason for being in the Board of Health, and that these are considered opinions. And they should also know that we work to have consensus around those opinions, and even where there are points of disagreement, what we're doing is working for the benefit of the citizens of the township. Does that answer the question that we on the discussion we had, Nota Sorn?
Yep. Yes.
Okay, so that's those two pieces. But you also raised another question, and that other question comes up today. In that I read, so I don't know who everybody's commissioner is. My commissioner is Lisa Browski. I'm Ward 4. Lisa sends around a spectacular regular update about what's going on, and it includes updates from the Board of Commissioners meetings. And I read them because there's lots of good information in them, and I don't know whether your commissioners are doing that, but if they're not, you ought to get on the phone and tell them they should. In Lisa Borowski's report, there was mention of, at the last Board of Commissioners meeting, the appointment of a new member to the Board of Health, and it wasn't you, Soren. So there may have been a mistake in name or typo, and she may have been referring to you, or there may be another ghostly new member of the board, and I don't know. So when Bob came on board, Lisa gave me the opportunity to talk to Bob in advance of his joining, which was it was good for me. There was never any doubt. I mean, if you look at his CV, there was never any doubt that he would be a welcome addition. But that's not always necessarily going to be the case. But I think it should be good for the new applicant, because maybe this is not what they think it is and not what they are interested in joining. And rather than put people through the process, you can't ever know until you're in the room. But it might be that it's not what people expected. And Julie, I did not have the opportunity to meet before, and nor did I with you, Notisorn, and I don't know whether or not there is. So furthermore, worse than that, there may be somebody out there who might have been approved and ought to be at this meeting. And Notisorn, you didn't get your link to the Zoom because you weren't on the list yet. So I think that and the we is outside of just the members of the board, but our support and our Board of Commissioners, I think we should have a better defined and better aligned and communicated process for that. And I'm not exactly sure how we should do that, but I would think that it would need to involve Kevin or Mr. White, who is the township manager, in case you don't know that, as well as representation from the Board of Health, as well as either Maggie Myers or Moira or both, because we are formally empaneled. There are rules about our meetings. They have to be available to the public. We post minutes, we post agenda, we include public participation. And I think that maybe a review of the mechanism for by which new members come on board would be good for everybody. So I just lay that out there. And I'd like to hear, especially from Bob, Julie, and Notisorn. Kathy and I are old hands, but I think the turnover is inevitable, and I think it went well from my point of view with Bob, because he was introduced in advance, and we had the opportunity, and that probably should be how it is, and we might want to move in that direction. So, Julie, how does that strike you?
Yeah, absolutely. Especially because the first meeting that I came to, where I met all of you, I was actually on Zoom, and my video did not work. So I haven't even met any of you in person, which is okay. But that would, yes, I think definitely it would have been great to have seen a face beforehand, and to have that kind of bridge before, you know, just.
Yeah. So the other, and Bob, you have comment in this regard?
Yeah, I agree with you, David. I thought it was really helpful for me to talk to you personally on the phone prior to me actually applying and learning about what the board does, what the responsibilities would be, and how it functions. I thought that was very helpful, and it really kind of sealed the deal for me to know that I definitely wanted to be on this board. So I thought it was extremely helpful.
Well, excellent. So I will take it as an action item with whoever among you might want to be a part of it. And I think Notisorn, since you raised it, I'd like you to join me. But certainly Julie or Bob, if you want to be part of it, or Kathy, but I don't need to distract you people from your other lives. But I think Notice Orton and I should work with Kevin and Maura or Maggie to figure out what we need to do and move that forward. And between now and the next meeting, I'll take an action to get started on that and make that work better. And I put that in the same lump of, we've had a rough go this year in terms of consistency of our meetings. We're supposed to meet on the third Monday of every month. I think we've done that once or twice this year.
Yeah.
Sometimes it's twice. It's been because Mondays have been holidays, and several other times it's been because other meetings have if the Board of Commissioners needs the room or needs the support, you can see what happens tonight. We don't get that, so it makes sense for us to be flexible around them. But I just wonder if there's not a better way for us to be scheduled such that we can have consistency, because I can see, Bob, you're still in your work clothes. And 5:30 is not necessarily the easiest time for everybody to get to, but I think it's actually a good time because at least it's supposedly after close of the shop, 5 o'clock theoretically. But if we could get some more consistency, I think it would be helpful to everybody else. So that's the other thing I'm going to keep pushing. I think our meeting calendar is kind of set, but as we work through the rest of this year, I'm going to try and figure out how we can be more consistent after the summer break in scheduling our meetings.
Hey, David, is there indeed another new person on the board that we don't know about?
I just don't know.
Okay.
I'm going to explore that. I did send a note off to Lisa. I had not heard back from her as of the time of this meeting, but I think they're scrambling a little bit. There's I don't want to
because there is a finite number. You know,
Well,
there is.
I should say it's my commissioner is Jake Abel. While it is true that actually it's Lisa who was suggesting the pathway, I suppose, is how I can be involved in looking into this process. Certainly, it was taking me some time. One thing I should say that the recorded meetings was helpful to get to know what you all are doing, and also kind of the agenda. That's also helpful. But I definitely second what Robert just mentioned, that speaking to the actual Board of Health members is extremely helpful to get and an opportunity to not only meet with all the commissioners, which is part of the process that I have. I mean, I'm sure that's what Robert and Julie went through as well. But in addition to that, meeting with the Board of Health member, that would be really helpful too.
Okay, so you and I, so I'll close this agenda item out with an action item for me to work with Notice Orton and the appropriate powers that be to define a better process for taking nominations and moving them onto the board and approving them. And I have the open agenda item trying to rationalize our meeting schedule, which may be a labor of Sisyphus. It feels like I rolled that boulder up the hill, and it feels like it's right back down to the bottom. But I'll continue in that line. Now, so unless there's other comment, I'm going to skip the county update, Board of Commissioners update, because we don't have any commissioners or county folks here to give us any update. But I do know, and I'm about to go off of the Zoom window, and getting back to it is sometimes a little tricky, but I want to pull up Kevin's health report. Because that's next, and it's relevant here because food safety inspections in January were still being done, and this is reading out of Kevin's report, still being done in the month of January by the third-party consultant who took over the inspections when Maria left to join the new county Department of Health. And Maria, who Notice Orton used to be the health officer for the township and was personally hands-on responsible for doing the health inspections is now going to be responsible for running the department, the section of the new county health department that will be responsible. So that should make for a good transition, but at least as of the end of January, we still had third party. I don't have anything more to report to you on that. This is from the health officer's report. The second bullet point was that there was a single animal related incident where township staff and township police were involved. There was also a commercial pool water quality issue that the Pennsylvania Department of Health was involved in and coordinated with township staff, and there were no special events in January. So while I still have that up, I do not have any more information than all of that. Are there any questions in that regard?
No.
All right. So let me try and figure out how to get back to me being able to see participants. There we go. No. Anybody know what button I have to push to get you guys back on the screen?
We see you, so.
Right, I'm still on the camera, but when I went to my Safari, I guess maybe I have to go to the Zoom down at the bottom.
Yeah, open up a browser.
Yeah. There it is. I think there we go. I'm back. So just for context, Notice Sorton, I think you might know that public health in Pennsylvania is administered through the State Department of Health, and it administers its policy through the county level. And Delaware County has not had a Department of Health for the duration of the time that I've lived here, which caught us a little bit short when the pandemic struck. And now in the interim, there was a new administration for the county, and they decided to actually empanel a Department of Health. There is a Department of Health being built out, and a health commissioner, and there will be a transition of any number of township responsibilities over to the county Department of Health, and that we have had an excellent health officer in Marie Carbonara who regularly came to these meetings and was before me our liaison to the township staff. So we got kind of double dinged when she left, but the food inspection piece has been handled by a third party. Okay. So with that, I'll move on to the next agenda items, and those are all the follow-up items, many of which involve people who are not here. The first is school board relationships, and Julie and Bob, I'm not sure the degree to coming on new. There was a time in the past, I don't know how long ago, before I was part of it, that there was a direct relationship in the form of a liaison officer between the school department and the Township Board of Health. It's not at all unusual in Pennsylvania, at least, for there to be separate governance board of commissioners for the township and for the school board, and such is the case in Radnor, where the school board is elected separately and budgeted separately and run separately from the township. We are again a volunteer panel serving at the pleasure of the Board of Commissioners in consultation to them, but I think it would be pretty darned blind of us not to understand that a significant chunk of the public health issues that might arise in the township would have to do with our greatest asset, which is the youth of the township. And we have been working to reestablish a direct relationship between the Board of Health of the Board of Commissioners and the school board. And Alex and Wara have been the two individuals on the Board of Health who have been doing the heavy lifting on that. And the progress has been painfully slow, not because there is any resistance, just because it is incredibly bureaucratic. First, we have to get the school board includes a school superintendent and a chairman of the board. And we had to get alignment between the Board of Commissioners, the school board, and the school superintendent. And a letter has gone out from the Board of Health by way of the Board of Commissioners to the superintendent of schools and the chairman of the school board. And one of the reasons these things take so long is that during the interim between last meeting and this meeting, people were asking me, where's the letter? Was there a letter, and where was that person being, I think Bill White's executive assistant. So I'm not sure where Maura and Alex have been taking care of this. Maura took on the responsibility to ensure that it went through the Board of Commissioners to the appropriate people in schools. I'm pretty sure it went out, but I'm not sure exactly where it is. So that's the report on that. And you can ask me, you can put red hot pokers under my fingernails, and I couldn't tell you more than that. So that's where we are, and that will be ongoing. And I should editorially add for the newer members that it has been kind of my raison d'etre as chair over these last 13 months, and even before that, when the pandemic hit and we didn't even meet our last two meetings of the first year of the pandemic, and it felt like everything was swirling around us, and we, the Board of Health, weren't doing much, I got really kind of upset to the point that I had thought about leaving, but rather I decided, well, what I needed to do was to change the way the board did business and to secure more firm relationships with the parts of the township that we exist to serve. And so I've been pushing hard to increase the amount of communication with the Board of Commissioners. I've made it a point to have regular meetings with the township manager to involve Chief Flanagan of the police, the chief of police, with us as much as possible to reach out and initiate this tethering to. I think we just need to be better tethered to the various action arms of the township in order to be able to be effective. And so this was one of the things that I initiated, and Alex and Maura have been doing the work on. So again, get the red hot pokers out if you want any answers to any questions more than that on the school board thing, because I got nothing more for you on that. The next issue item is one of the things that that is ongoing from the end of last year, and neither Joan nor Maura is here, but I forget who was responsible for initiating a review of our animal ordinances, but somebody initiated it.
That was Marie. That was Marie before she left.
That was Marie, and it was,
Yep.
I don't remember what the trigger was.
It was very old, very,
Just
very old.
because it was
I've been
older,
up to
I don't remember if there
old.
was an event. It was just old.
No. It was just old language, and it hadn't been updated in years.
And that's right. And she sent it out to all of us, and most
Correct.
of us read it and scratched our heads. And Joan, who is not here with us tonight, but is a veterinarian,
Yes,
and a passionate
yes.
veterinarian,
Yes.
had a lot of comments. So she volunteered, as the rest of us took one step back. She volunteered to step forward and take on the role of completely reviewing all of the township ordinances. And as you might imagine, that has been a substantial labor on her part, but a lot of things were identified. It will all have to go through the Board of Commissioners, and some of it may require ordinance changes. It is to the point where the township solicitor and the township animal safety officer are involved. And I think that's one of the contributions of this board, mostly Joan, but of this board, that one of the most tangible contributions that we've made in the last couple of months is a complete updating of the animal ordinances. And I think it's more than just the animal ordinances. I think, I don't want to make any promises, but I actually believe that they may be able to get that done by the end of this school year. We shall see.
So did Joan give you an update, or there's no update yet?
Joan sent me an update on, we are fine tuning the languages of the changes before they go to the Board of Commissioners and Township Solicitor.
Because that had to go to the solicitor and the solicitor was gonna look at it, right? Okay, so it's
No,
still
I
language.
think it has already been to the solicitor who made
Got it, okay.
significant recommendations, went back to
Got it.
Joan and Maura. Joan and Maura are fine tuning those changes. It will go back to the solicitor for what one would hope is a final review before going in front of the Board of Commissioners.
Got it.
That's my understanding of how that goes. And a corollary to that, which is also a corollary to the next agenda item in Joan's notes to me, is that there, in addition to the animal ordinances, dog park safety rules needed to be upgraded, and Joan was kind enough to take on the dog parks rule safety revisions. And she has had meetings with Bill Gallagher, who is the animal control officer for the township, and Mary Coe, who is Parks and Recreation head for the township. I got a tax bill recently, and there was a nice multicolored flyer from Parks and Recreations about all the things that go on in Radnor that I didn't even know that we have a pretty robust Parks and Recreations program. But Joan is involved in the safety rule revisions on that, which leads to the third bullet point under old business, which is the road safety in Radnor Township. And again, for the newer folks, and especially for you, Notisorn, there is not complete agreement on among everybody on the board on exactly what should and should not be done in all cases, but there is complete alignment on the part of the board on the notion that we are not an urban township. 10, 15 years ago, we might have even been in, maybe 20 years ago, we might have even been an ex-urban township, and now we're clearly suburban, but we have a lot of open space, and that open space includes a lot of habitat for wildlife that includes not only birds, but four-footed animals, and that the preservation of safety on the highways, both for biped humans and for the four-footed animal friends who live here as well, is a concern for all of us. And Joan had a strong passion about that and has been working with public safety and the police department to upgrade the location of and quality of signs designed to protect our animal life from adverse interactions with motor vehicles. So that's another thing that another palpable, concrete thing that the board has been involved in that I think represents an upgrade for the citizens of the township. And there is one, so and if please, I'm moving pretty fast and I'm absolutely monopolizing the microphone. If you have any questions, please butt in, please don't hesitate. And I try and stop regularly to take comments, but if you have comments, please raise your hand, shout out, take the microphone or whatever. So let me just give a pause there. Are there any comments from anybody on the item so far? Good. The last item is a follow-up item that is my responsibility, and that is we do take public participation, and it's part of the rules of the committee. And it's now, I think, 3 months ago, to February, January. It was either in the
Yeah, that's
November.
about right.
It was a well-known and concerned citizen of the township, Sarah Pillington, came to the microphone. She not infrequently appears in meetings of the boards because she has a passion around climate change. She's a gardener and an animal lover, and she is quite concerned about climate change. But she came to the Board of Health to report something that she wondered if we could help with, and it was actually two things. And that was last summer, her underlying hypothesis was that we are having progressively more dangerously hot days and stretches, and that's not going to stop. And I agree with her on both of those things. And in the summer before the pandemic, there had been two programs that she thought were salutary for the older population, within the township during these potentially dangerous heat waves that we have had. One of those programs was the distribution of fans for people who could not necessarily afford or be able to get out and get fans for themselves to make their homes safer. And the other was a program of having cooling zones available for people who might not have air conditioning or the ability to keep their home cool enough, that was provided by the township in the township building. It took me till the beginning, till the middle of January to get to Bill White and have a discussion with the township manager about those. And I'd like to close this item out. We discussed both of those. The first I'll take on is the fans. And Bill pointed out that the fans were not a township program. I believe he told me that it was a state program and that the township acted as the distribution arm for a state program for distributing fans. And since that is the case, I don't think that the township and therefore the Board of Health as an arm of the township has a role in that program. And I'm disappointed to report that back, but that is the way it is. The other issue was the cooling zones, and Bill said the cooling zones was just a straightforward pandemic issue. The building was not available for access to groups at the time, and that he certainly does anticipate and will put it on his list that should there be a necessity to open cooling zones, that he will work, conditions permitted, and those conditions being pandemic, but conditions permitting, to have cooling zones available. As I say, all other things being equal. So I think we can finally, Kathy, that's my
Yeah.
report back. There are no
Got it.
action items for us here, but I think we can close out that.
Did he mention the trigger? Is it 90 like what's the trigger temperature wise? Did he mention that?
He did not, and I didn't
Okay.
discuss it.
Just
and
curious.
we could certainly.
No, that's fine.
As we get close, and I think as we get closer to the warmer weather, we may want to look at that again and see if we can provide support to the township to make that a better, a bigger, maybe better, or more points of access, maybe better. And so I think maybe in the minutes we should reflect, we should take that back up, say in April or in May. And in the meantime,
okay.
I'll talk to when next time I speak to Bill White, I'll talk to him about what's involved and what might be involved in that.
Okay.
So if there are no other comments, questions, or concerns, that closes out old business. Now, the next item on the agenda is the student interns project. And Anna and Hajun, I'm sorry how rude that I was. I didn't introduce you, and I didn't ask you to introduce yourselves to Notasorn, but I think maybe we should take a moment to do that. Notasorn, we have, since I've been on the board, had an annual student intern project early in the school year. We take applicants from the school district to be involved in an intern project. It is mentored by members of the Board of Health. They take on a research project and work to put a report together at the close of the school year about what they accomplished with their research project. Lisa was unable to join us tonight, and she said that she had not expected Anna and Hajun to provide a report. So I'm not expecting them to speak up. Pressure's off, guys. But maybe you can take 30 seconds each and introduce yourselves to our new board member. Anna, please go first.
Well, hello, my name's Anna. I'm a senior at Radnor High School. I've lived in this area basically my entire life and have gone to Radnor schools for the entirety of my education. Um, but yeah, as was mentioned before, I'm one of the student interns here, and the project we're working on this year is to examine the effects of excessive headphone use on hearing loss in adolescents. And it's something that I'm really excited to continue researching this year.
June?
Wonderful. Nice to meet you.
Yeah, hello, my name is Hajin Kim, and I'm a junior in Radnor High School. And I came to this community like 2 years ago, but since my uncle is living in this area, I came to this community like a lot. Like yes, I'm really I'm really excited to to work with you guys. And yeah, so like and I says we're like working on a report. So I'm really I'm really looking forward to like finish this and like just going to like present about what we found.
Awesome.
Excellent. Thank you.
Thanks.
So next month, I think you two are meeting with Lisa next week, I think is what she told me, next week sometime, or maybe it's this week. And that you'll coordinate, and probably we should expect some form of update from the intern project at our next meeting. So 3 items left on the agenda. I think I'll move the COVID flu update back a little bit and ask if anybody on the call has any new items they want to bring up.
David, I have a question regarding if I wanted to investigate the oral health program currently available in the school district for kids. Would I work through Lisa for that, or do I had cold called some of the nurses in some of the schools, but I don't know a proper channel to actually make that happen.
That's a great question, and I think that rolls back to our. That would be an easy answer if we had our school board liaison. And what I think for the moment, I'm going to suggest that first I'd give Alex a call, because he has really been doing a lot of work in exploring school board relationships, and just feel out what does the landscape look like. And the other person I'd kind of like Dr. Myers, who is our Board of Commissioners liaison, to weigh in on that. Actually, though, I need to stop for a second there. Maura had said that she had become invested in several of our projects. I'm guessing she's going to start to get overwhelmed as the chairman of the board.
She took on chairman, so yeah, she's going to get
quick, and she may decide that she is going to turn it all over. So yeah, let me say, talk to those two, and maybe you guys can and maybe you can figure out how to get that. I think that is a perfect example of what it is I'd love for us to be doing for the township. I'm thrilled at your proactiveness, and I don't have. I'm vamping here because I don't have a good answer for you.
Okay. All right.
But Alex, let's start with Alex and Maggie, and please let's put that as a new stepping forward. I think we should put that as an next meeting between now and then. Let's see what you can get done, and next meeting come back to us with what you've gotten and what you need, because I think that's fabulous. Thank you.
Great, thank you.
Anybody else? So I keep COVID and flu updates on this agenda, because I can't really imagine any health issue single health issue that's bigger than that right now. And notice, Soren, for your benefit, I don't know if you're aware that we sent over a document to the Board of Commissioners, to the Township Manager, and to the Chief of Police. Did we send that out we sent it out in December, right?
Mm-hmm. Yep.
where we made a fairly strong recommendation that despite the fact that at this point, there are not state or county mandated requirements for masking or proof of vaccination for meetings, we strongly felt that with circumstances as they are, with cases at an all-time high, at that time cases were skyrocketing, hospitalizations at an all-time high and deaths at an all-time high, looked at from the point of view of national agglomerated data, but also in a township that has been fairly fortunate with regard to the health impact of COVID, but that Omicron might represent a change in that if we were not vigilant. And our recommendation was that we should not go back to mandating, but that meetings, whenever possible, should be taken remotely, as we are now. That meetings should include masking for everybody, and that business done in township facilities should include masking. It actually was a harder job than I anticipated putting together a letter, because in the absence of a state or county mandate, we're not an ordinanced body. We're a advising consent advisory body, and the last thing I wanted to do was put anybody in a conflicted situation where they didn't have the power or authority to do that, but to give them the Board of Health imprimatur that this was an important issue, and it was much appreciated by Bill White, but he pointed out that as much as it seemed rational and logical, it was not necessarily as easy to enforce as you might hope. And we're a slow-moving organization, and this is a fast-moving pandemic, and advice that we might have made 6 weeks ago may become more or less relevant as things change. Furthermore, I had a little bit of a tete-a-tete with Alex, and we didn't completely agree, and I had kind of the same conversation with you, Notice Thorn. Whereas I believe that the most important thing about a mask is having one, the second most important thing is wearing one, the third most important thing is that it fits, and that after that we can have a fight over whether it should be an N95, a KN95, a three level tightly woven cloth, or a surgical mask. And I think we were both completely aligned that a population where 100% of the population wears a well-fitting N95 mask provides the most protection. What provides the least protection is nobody wearing any masks. But even that wasn't as easy as you might think it would be. And I think that one of the things that we might be able to do as the Board of Health, because if you watched any football during the NFL tournament, if you watched any golf when they covered the golf, or any basketball, from the point of view of the United States general public, this epidemic is done, but it's not. And I'm praying that Omicron represents an attenuating strain that ends the public health crisis and transitions into a new world. But that's not proven yet. That's not given yet. And I think that we might be able to be helpful in communicating why, as a community, it is important sometimes not to emphasize your rights and privileges, but your roles and responsibilities to your neighbors and to the community. So I'm not sure that this is a bit of a blah blah blah. I'm not sure exactly what we should. I've been batting this around for a while, but I wonder if we shouldn't consider putting together a subcommittee and thinking about things that we can do. I don't think that in 1 hour a month as a body of the whole, we can begin, we would destroy any other agenda items just doing COVID work. But I wonder if we shouldn't perhaps put together a subcommittee and talk about what are the things that we can do to help our community get through to a hopefully brighter, better world when we emerge from the pandemic. So I put that on the table. I don't necessarily have any more concrete of an
David, I'm just worried that we're going to be spinning our wheels for something that's never going to be state mandated.
Yeah,
So
no, I
yeah,
don't-
we can make recommendations, but somehow we have to live through this next couple of months and live with this virus as it will be with us. So we don't want to go back. I would not want to go back to having kids not in school and everything shut down, if all
Right.
possible.
I could not agree with you more. And I
Right.
believe that the mandating programs imposed mandates, the higher the level of the mandate and the broader the mandate have backfired.
But maybe we should be, I mean, I have a personal level. I have a sister who is immunocompromised with liver transplant. So how do those select populations, those that really have comorbidities and those that are really prone to get this pretty bad, and those that immunocompromised, how do we help those folks live and solve the questions of how they can live with this pandemic? Maybe
yes,
we
I
should
think
focus
I-
more on those groups rather than the healthy who've been vaccinated and boosted and,
Yeah,
they're,
so I couldn't agree with you more about everything you said. Well, so nobody wants to disrupt the economy again. Nobody
Right.
wants to shut
No.
down. And there's no doubt that one of the undervalued issues at the beginning was the degree to which mitigation, which is in and of itself an isolating, distancing,
Mhm.
kind of shrinking of your own space, the degree to which that would have adverse effects that are demonstrable and measurable. And I don't think any of us at the beginning thought that the level of political rancor would be brought to it. On the other hand, if wearing a mask is seen as an action of civic courtesy and citizen responsibility, not as a mandate from a government above, but rather this is something you can do to help your neighbors out, because we don't want to exclude people over 65, people who are
Right.
immunocompromised, and we don't want to exclude them from so maybe we can work on correcting some of the misinformation out there. So there are a lot of people out there,
Right,
masks don't work. Well, masks don't work if you wear them on your chin, and they don't work if
Right.
they're a balaclava, but they do work. I mean, I don't think anybody out there who tells you masks don't work wants Bob operating in their mouth without wearing a mask.
Right.
So maybe we can work on communicating some of the scientific basis for recommendations and make them as recommendations. And Julie, I please jump in.
Oh no, I was just gonna say it's next, when is it, the 24th? Next Thursday is when masks are optional in the school district, and I feel like that's gonna complicate a lot of these kind of recommendations too, when kids are no longer going to be wearing masks.
It will, and so I think the kids are a special issue, and that's another one where the sooner we can get school board representation here, the better we will be, because I think that there's a lot more on the the negative side of the balance pan for kids constantly being masked than there is for responsible adults wearing masks in public meetings. Those are not the same thing with the risk benefit balance. And I certainly don't know, but good.
But I feel like when teachers are they're not, I just think like they don't have to wear masks. So I can imagine, I agree with you. I think people should be I think we need to be wearing masks. I mean, I don't see any downside to it.
What I just did, I'll tell you, what I just did, touching my face, man, I should never touch my face ever these days. One of the things about masks that people forget, people forget that the flu is out there as well, and B, one of the things that masks help me to do is keep my hands off my face. So I think maybe we can change the tone of this discussion we're not going to be able to dictate or mandate, but maybe we can educate and maybe we can elevate the tone, and that if we could do that, I think it would be a great public service. I know that my last 5 years in employ, I was a global. I was the chief medical officer for a global company. I spent a lot of time traveling. I spent a lot of time traveling during flu season. And let me tell you, there's a lot of parts of the world where masking up for flu season is nothing new. So I don't really need to bring it. I may be sending out some notes and trying to impanel. And what I laid that out there for today was if people have ideas about things that we might be able to do, it will not be mandating, it will not be dictating, but it might be, as I say, educating and elevating.
Like wearing your seatbelt is one of them.
Like wearing your seatbelt, which, by the way, when I was Hajun and Anna's age, there weren't seatbelts in every cars. In every car, most people didn't wear them. Their parents were smoking in the front seat, and they were driving out to a 3 martini lunch on a regular basis. So,
David, you're showing your age.
You better believe I'm showing my age. So, at any rate, I'll get off the high horse there, but I really think that that's an area that we might be able to come up with some ideas to be helpful to our community.
So what do you want me to put in the minutes? Your ideas to move forward with information? Like, what do you want me to?
I'm soliciting.
You just ran it. I just don't want to put down.
I'm soliciting suggestions and ideas for what we might be able to do as a
Okay.
Board of Health to improve the health of the community by providing education and elevation of the dialogue, and get people to engage in healthy behaviors, if not for themselves, to be good citizens of the community, and not because we're telling you to, but because we're asking you to.
I like your words, healthy behaviors. I like that.
Okay,
I
excellent.
like that.
I think if we put a positive spin on it, it's not like a mandate. It's like to help each other.
Bingo.
Help your kids, help the older people in the population, help each other.
So let me get people to think about that. If you have ideas, please feel free to send them out to me at any time. And right now, I things are going to move more quickly than we can. Let's see how they are.
Yes.
My fervent hope is that our next meeting will actually be an in-person meeting, but I wouldn't hesitate to Zoom again if I thought that current levels of communication of the disease were too high. Come that time, I wouldn't hesitate to Zoom again. And if we find out that in fact we might have once again kind of jumped too soon, and that we start seeing another wave, I wouldn't hesitate to stay with Zoom. But I really would like to meet you in person, Julie. I really would like to meet you in person, and Anna and Hajun, and listen, I know the value of in person, but again, healthy behaviors. So with that, Lisa, is there anybody online, or Ian, anybody online for public participation? Are we muted, sleeping, or did we have to? If there is not, I'll give a couple seconds here. If there's nobody, that's fine. So I'll take the absence of evidence as evidence of absence, even though that's always a flawed approach, and say that there is no public participation, and ask for, if there is nobody else on the board or among the members here that has a comment to raise. Oh, notice, Soren, you have something?
I just raised my hand. I wonder, since we're talking about different topics, and Nguyen would wonder if we could have a session, or maybe you can share some information as what do we envision our role, or I'm sure everybody have their own vision already, is how they would contribute, or what's the role of the Board of Health in collaboration with the Township as a broader organization, as how do we work with the school board, what do they expect from us, or the baseline need assessment in a way, as to kind of to know what they would need, or how we can better served in a way. So in terms of the more specific for COVID and flu, what my hope would be that the Board of Health could be a resource for information that at least help kind of clarify potential misinformation or completely disinformation that are circling in our communities. So I know that maybe we can have kind of, everyone has different perspective, but I wonder if at some point we can clarify or talk about the structure and the roles, how Board of Health can work with other groups and other teams.
Well, I can answer.
More
I think
succinct
there's-
way.
I think those are two separate questions. One is the structure is defined. We are a volunteer board.
Yes.
We have no budget and we have no action arm. We don't have the tools to act except the work that we do as volunteers. And our work is through the Board of Commissioners. So if anything that we do needs to pass muster through either the township manager or the Board of Commissioners or both. But that being said, and we don't really have, as of yet, a formal role at all with the schools. The schools, as I say, have a separate board of a separate school board elected independently. I think they have elections every election cycle, and half of them are elected every election cycle. So they turn over completely every 2 years, or is that, no, they're 2-year terms. They turn over
2 years.
every 4 years, and they have a superintendent that is hired through the school board, and and they have their own budget. So we have no capacity to compel anything at the schools, which is why I've worked to get to the point that Alex and Maura can work to get a liaison from the school board into our Board of Health, and that will help, and hopefully that will allow us to help to serve more effectively through the schools. But the main way we've served the schools is through our student intern program since I've been there, and otherwise it would only be through any role that the Board of Commissioners might have at the schools. But regarding, I think that what you just said regarding COVID is exactly what I'm talking about. So can we develop information for the township? I don't think that we should consider trying to compete with the CDC, the FDA, the NIH, the State Department of Health, or the County Department of Health. But I do believe that as citizens of this township, we could certainly play a role in helping to digest and package information in a setting where there is a lot of misunderstanding and disinformation, to provide quality information. And our way to do that would be through the work that we do through the Board of Commissioners and through the other arms. So there's nothing to say, once we can cement this relationship with school board, that we couldn't work through the school board. And by the way, there's nothing to say that perhaps we couldn't establish a relationship with the new county health department to expand what we can bring to the table in our voluntary efforts throughout the county, and if we get anything that's really hot, even to the level of state. So that's my answer to your question. I don't know if it's satisfactory or not, but that's the best I have for you.
But also you can bring forward any projects. For instance, Robert's doing the oral health. Joan did a lot with the animal work. We've done chicken issue, having chickens in your yard issues. Like, if you have a project you think would benefit the township, bring it forward. We'll talk about it. Right. And we can, if you want to work on it, feel free. It could be a project that you would like to see in the township. COVID is certainly, we've been working on it as much as we have input to it. But if there's anything else, bring it forward.
So I think that we should, if you're willing to, notice, and I think that I would be happy to ask Kathy to put an action item for you coming back to the next meeting to put together some kind of an outline, a straw man for what you think concrete things that we could do as a board, led by you, with the support of the members of the board who might be interested, and how we as the board could enable that. I know that I am very interested. I've made COVID a new career for me. I read everything I can get my hands on. There's nothing published in JAMA.
You got to get a life, David.
Say again?
Got to get a life, David. Come on. Start watching Netflix. What can I tell you?
So I'm very interested myself, and I think that's exactly what I was looking for in terms of what we can do moving forward. Okay.
Sure. Yes. I certainly am. I'm interested. I'll reach out to, seems like Alex and Maura working on the school board relationships and how that worked together. And certainly will be trying to reach out to the Delaware County Department of Health just to see how well we can collaborate and work. I'm sure need assessment is part of their plan as they're starting up a new department. They would like to know what we would like help with and how we can work collaboratively together. I know we're not having any we're advisory board in a way. So, but anyway, I feel like we can certainly represent and trying to kind of tease how we can work best together. Yeah.
I think that's great. I think we are a wealthy community in so many ways, and not the least of which is that we have a great population with a lot of capability and people that are willing to volunteer. And if we could extend that wealth through through the contributions that we could make, because that's not necessarily true across the entire county. I think that would be a huge contribution. So thank you. And with that, I'm going to ask for a motion to adjourn.
I motion to adjourn.
Any seconders?
I'll second that.
Are there any naysayers? If not, the meeting is adjourned, and I'll look forward to working with everybody between now and the next meeting. And
March 21. March 21.
March 21.
There you
Monday, March 21. Be there or be square. Thank you, everyone.
All right. Nice to meet you.
Bye.
Bye-bye.
Valentine.
Bye. Thank you.
Thank you.